Welcome everyone, saludos, and thank you for joining us. Today's Tanoma Consulting Latinx Health Webinar Series focuses on diversity and inclusion for all of us, Hispanic Latino representation in research. We will discuss the importance and benefits of Latino engagement in research and how you can contribute to science as a participant of the All of Us Research Initiative. We're joined by Nurse Susana Gonzalez and Dr. Elizabeth Aquino, two representatives from the National Association of Hispanic Nurses in Illinois who serve as National All of Us Liaisons. We also have Ms. Monica Rodriguez from the All of Us Community Engagement Office at Northwestern University. Before we begin, we wanted to please note that we'll leave a few minutes at the end of the session for Q&A, so please enter your comments or questions in the chat box. And to please follow the conversation by using Twitter. You can use the hashtag Latinx Health or hashtag Tanoma Consulting, and tag us at Dr. Ponte Soto, at Sue Gonzal, and All of Us Research, and at non_Illinois. Bienvenidos again. My name is Lisa Ponte Soto. I'm the founding president and CEO of Tanoma Consulting, the lead sponsor of this webinar series. I'm a health and equities researcher and evaluator trained in public health, community participatory, culturally and linguistically appropriate practices. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research, evaluation, and training services to advance health, education, and workforce equity. And our vision is simple. We aim to create innovative strategies that foster equitable practices for all communities. For more information about our services and training opportunities, you can visit us at www.tanomaconsulting.com. It is my esteemed pleasure to introduce our first speaker for this evening, Dr. Elizabeth Aquino. She is the associate professor at DePaul University, and she is the past president of Non-Illinois and a national board treasurer with the National Association of Hispanic Nurses. Dr. Aquino is the immediate past president as well of the American Nurses Association, or Non-Illinois, the professional association that represents the interest of Illinois' 190,000+ registered nurses. She's also the current treasurer of NON. Through her nursing background, research, and community service, Dr. Aquino has focused on the many issues that ethnic minorities and underserved communities face that impact their health. Aquino has demonstrated her deep commitment to helping others through her volunteerism and community service with various nonprofit organizations, where she has shared her expertise to help address health disparities. She has promoted a vision of healthcare advancement in Illinois and nationally by serving as a leading voice for Latinx nurses on local and national boards, advocating for the nursing profession and providing services and resources to Latinx communities. Dr. Aquino's clinical background is in critical care, specifically surgical trauma intensive care nursing. She completed a bachelor's degree in psychology and biology from the University of Illinois at Urbana-Champaign, a master's of science in nursing from DePaul University, and a PhD in nursing science from the University of Illinois at Chicago College of Nursing. Following Dr. Aquino, Nurse Susana Gonzalez will be joining us. And Susana is an amazing nurse advocate and leader who is fully commits to everything she embraces. And I can truly attest to that. Her purpose in life is to leave the world a little better than she found it. She's an exemplary role model and servant leader dedicated to mentoring and developing the next generation of bilingual, bicultural, Spanish-speaking nurses and promoting all levels of education in changing their lives. Susana currently serves as a nurse consultant, an educator providing education services for a home care agency in Chicago. She also serves as an adjunct faculty at an ADN and a Master Entry Schools of Nursing program. Among her strengths, Susana excels at developing and leading operations, academics, simulation skill learning, and partnership development coordination. Throughout her career trajectory, she continues to be at the forefront of healthcare issues for women, infants, children, and the nursing profession. Susana has served on many boards of directors at the national, state, and local levels, as well as advocacy groups and committees, including the March of Dimes Chicago, Mujeres Latinas en Acción, the Chicago Bilingual Nurse Consortium. She is an active member of the National Association of Hispanic Nurses, Illinois. She is also past president and serves as a national board member. Recently, Susana volunteered on several medical missions in Puerto Rico post-Hurricane Maria. Susana has received recognitions and awards for her compassionate servant leadership work, including the Regional Volunteerism and Service Award for Nursing Spectrum, the Illinois Maternal Child Health Coalition, Aspira Excellence in Health Award, March of Dimes Outstanding Nurse of the Year Award, the National Association of Hispanic Nurses Community Service Award, and the March of Dimes Jonas Salk Nurse of the Year Award for her commitment to service. And most recently, Susana was recognized as the 2020 Nurse Influencer by the American Nurses Association of Illinois. Yes, most recently, like just a few days ago. And these are just a few of her many, many awards and recognitions that are very, very well deserved. Susana also holds a dual Master's of Science in Nursing and Master's of Health Administration degrees. And finally, we'll have Ms. Monica Rodriguez. Monica is a first-generation Colombian American and Chicago native. She currently serves as Director of Communications and Engagement for the All of Us Research Program at Northwestern University. Monica is responsible for facilitating communication, strategy development, and implementation of the program within the hospital network and the community. She's passionate about widening access to healthcare for underserved populations. Monica holds a Bachelor's of Arts in Communications and Fine Arts from Bradley University and a Master's of Arts in Hospitality Management from Roosevelt University. Our session today is in partnership with Non-Illinois. Non focuses on supporting, mentoring, and increasing the pipeline of Latinx nurses and advancing the health in Illinois Latinx communities. If you'd like to learn more about Non-Illinois or become a member, you can visit their website at www.nonillinois.org. This session is also in partnership with the All of Us Illinois Precision Medicine Consortium. The All of Us Research Program is a part of the National Institutes of Health, and we're also supported this evening by the National Association of Hispanic Nurses. And we're excited to open tonight's discussion on diversity and inclusion for all of us, to be able to think through and address the importance and the value of inclusion, diversity, and representation of Latinx in research, and specifically communities of color. As many of you who are joining us this evening may know, communities of color are less likely to participate in research. And there are many reasons why, from mistrust due to historical abuse and trauma to structural barriers, including transportation, language, and communication. Among Latinos, who represent nearly 1/4 of the US population, and in some states or counties, 1/2 up to 3/4 of the population, only 1% sadly enroll in clinical trials. Like some of us can imagine, the importance of and value of it in a time like now with COVID-19 as we're trying to develop a vaccine. So given the disproportionate and persistent elevated rates of morbidity and mortality among communities of color, which have been further magnified by COVID-19, equitable representation of Latinos and Black, Indigenous, and people of color in research is more important than ever. Our panelists today are going to shed light on the benefits of Latinx inclusion in research, how it improves science through precision medicine and helps address health disparities. They'll also share the information for how you can participate in the All of Us Precision Medicine project. So without further ado, I will turn it over to Dr. Elizabeth Aquino.
Good evening, everyone. Thank you for joining us. Well, the All of Us Research Program is a historic longitudinal effort to gather data from 1 million people or more living in the United States. It's really meant to help accelerate research and improve health. And that means we're taking into account individual differences in lifestyle, socioeconomics, environment, biology, all of those things to uncover paths towards delivering precision medicine, which is really individualized prevention, treatment, and care for all of us. Next slide. So to expand on what is precision medicine, it's really to acknowledge that we are all unique. Our habits, our environment, our biology, and that the interaction of these factors greatly impacts our health. The unique variables also mean that a medical treatment that works for one person may not work for another. So this is a radical shift in medicine that provides each of us with the best care possible based on our unique makeup. Next slide. This is considered an innovative research effort. In terms of diversity, the All of Us program plans to build a cohort of 1 million individuals with an emphasis on including communities that historically have been underrepresented in biomedical research. This includes racial and ethnic minorities, older adults. In the future, we hope to enroll children, sexual and gender minorities, people with disabilities, residents of rural and non-metropolitan areas, and people with inadequate access to healthcare, low income, or low educational attainment. The program's goal is to have 75% of participants be from those underrepresented groups and 50% be racial ethnic minorities. We are working to build a community with a focus on participants as partners. So that means that the All of Us program includes participant representatives in the governance structure and asking for their input through surveys, focus groups, and events. Understanding health, including healthy aging and wellness, means that we need to include collecting data over time. Thus, that's the reason why we have a longitudinal design. In addition to collecting electronic medical record information over time, participants may also be asked periodically to complete new surveys and also offered opportunities to provide additional data and biospecimens. It will include a rich data set of electronic health record data, surveys, baseline physical measurements, and biospecimens, which does include genomics. The Research Hub will provide a national open resource for all researchers. The data and tools will be available for all researchers, including traditional academic researchers and those who are citizen scientists. And lastly, but most importantly, the All of Us is partnering with industry leaders in applying the latest technology measures to ensure security and privacy of participants' data. Next slide. The Precision Medicine Consortium is made up of these 5 amazing health provider organization leaders that are really key in helping participants to sign up for the All of Us program and helping collect the biospecimens. Next slide. This is All of Us, the All of Us network of partners who are helping move the All of Us research program goals forward. And those include national partners, regional medical centers like the one involved today in our Illinois Precision Medicine Consortium. And as we mentioned, that I just mentioned in the previous slide, and then the federally qualified health centers and community partners. The National Association of Hispanic Nurses, particularly the Illinois chapter, is one of those community partners that's helping to contribute to the All of Us research program, particularly making sure that there is a focus on Latinx representation in this program. Next slide. So where do we stand now with our progress? Thus far, we have had close to 300,000 participants complete the full protocol across the United States. We have greater than 81% from underrepresented groups, and more than 52% are racial ethnic minorities. So we're making great progress. And to get to those statistics, there has been a deliberate investment to support those goals, and those are listed here. Next slide. The program opened its doors for national enrollment on May 6th of 2018, and since then, participation has steadily grown. Currently, the All of Us program has more than 361,000 participants, as shown here, and those are individuals who have completed the initial consent process. Of those, more than 271,000 participants have completed the initial steps of the current protocol, meaning they've completed the electronic medical record authorization, initial surveys, biospecimens sampled, and they've given physical measurements. So they've gone one step forward. Next slide. As far as return of information, the All of Us research program views participants as partners and offer a return of value to participants in various forms. So participants are able to choose the amount and type of information they are interested in receiving, and it can be as much or as little as they prefer. All communication preferences can be selected directly from within the participant's portal account, which includes the app that you can download conveniently to your phone. Next, Susanna will discuss more about the engagement efforts of the program.
Thank you, Dr. Aquino. So, meaningful engagement with participants as partners is really part of the journey of what All of Us is intended. We have traveling exhibits and partnership events. We have done much local community outreach, as you can see in the lower right-hand segment of your slide. There's an amazing All of Us bus that comes out, and these are meant to be very interactive and very physical presence in our community. As we all know, COVID and the last 9 months of what's happening in our nation has affected very much the work of outreach and physical presence in our communities. So we have moved to digital. Hence, we are here today to support one another and to try to reach out to our community. Next slide. So nurses, we are nurses. We are so proud to be part of the Hispanic Nurses of Illinois, that we're a part of the National Association. We really take pride because we know that as nurses, for the last 18 years in a row, nurses have been the most trusted healthcare profession. The public counts on us. We count on being able to be the kind of persons that can explain things to our patients. We take such pride in educating and teaching. So it's a natural fit when All of Us and NIH reached out to wonderful organizations such as the Hispanic Nurses to reach out and to collaborate and work to help build a healthier future with all of us. Next slide. So here we are again, Dr. Aquino and myself, when we used to be able to go out into the community and get the word out of All of Us. We, along with our chapter members, provided health screenings and activities and outreach in order to engage in our community and in the heart. Our nurses volunteer of their time and their energy and their presence to really communicate the message of All of Us and how can we engage, how can you join. Most of us, hopefully all of us on the call and on the team are members to communicate and support what All of Us is doing and how to become part of this phenomenal visionary work of the future and research. Next slide. So we all have a story. As Dr. Aquino said earlier, we're all very unique individuals. We're not cookie cutter individuals, so that's why precision medicine is so important. We're compromised of different genes and DNA and lifestyles, and we know that as healthcare providers and leaders, we've been studying social determinants of health and how they shape who we are and what we become. And we all know that the zip codes that we live in, especially in this state of Illinois, affect our wellness and our being and how we access healthcare. So we want to be a part of something like All of Us and its programs and how to reach our community to be included in the future of medicine and health. Next slide. So everyone knows that COVID has significantly impacted and changed our life forever. We have been living in the last 9 months with the coronavirus that has come to this globe and has tremendously affected us. So all of us has also taken that ability of the research candidates, the participants, the us that have already signed up to collaborate and be a part of this phenomenal historical research, to be assess the information that's already there in collaboration with the national and international partners, so that we can continue to work and see how we can solve the COVID crises of the world. As you know, even in Illinois, as we speak today, we had another 12,000 plus positive individuals in our state. And it is very alarming and very concerning. There isn't going to be any quick fix until we can get a vaccine and be able to vaccinate our nation. So we're all in this together, and this is really something innovative that all of us is also going to take a part of. Next slide. So as we said, the scientific activities, we want to participate. There's a survey already going out to our individuals that are members of All of Us, and if they choose to participate, and everything here is like anything else, you can choose to participate in as much as you wish or can or desire. They'll be doing obviously antibody testing. We want to be able to pick up if any individual has in the last year or in the last 9-10 months been exposed or had it in their bloodstream while they were signing up for the program. And all of this is being shared and communicated and included with our partners and our individuals and everything. We all have electronic healthcare records. We all have access to the information and the data and participation of what's happening and where we are in the study. Next slide. So this slide, I will defer to Monica from Northwestern, and she will speak about getting ready and DNA results.
Thank you so much, Susanna. So excited to be here. Wanted to share from the initial first starting points of All of Us, the desire to have participants as partners has really been one of our foundational values. And what that means is that we're not just asking for information from you, and not just asking for information from your patients to share with the program, but also that we want to have a point and a piece to return of value back to you. And one of those areas of value and significant to us, especially in the Latinx community, really is to get back our DNA and to understand how our genetics plays a role in our health and how it'll play a role in our future generations' health. And so what we have just begun is starting to analyze DNA. So one of the goals of the program is to be able to return to each participant their individual DNA, and we are doing full genome sequencing. And the first pieces of the information that we are returning to participants is around kind of our ancestry and trait data. And so we're excited to say that we are beginning that process, and that some of the kind of return of information that we are beginning to share with participants, like what you see here on the slide, we have just kind of begun, and we are hoping to continue this in the months and years to come, and is a small piece of our kind of exchange and return of value, and the way that we're working together with this program and with our participants. Next slide. A couple of things, you know, a lot of people often ask me, what is the research that you're doing? Like, what kind of research are you doing? And the reality of it is that we are not trying to just answer one research question, but we're really making a database and a biobank, a place where research questions that we don't even have now could one day be used and studied from the data that we collect. So, you know, 2 years ago, COVID-19 wasn't on our mind. We would not have known that was.
And I have the honor to be your moderator tonight.
I'll keep going. I think if you would be so kind as to leave your lines.
Our president, Dr. Joaquin Estrada, is going to share welcoming words with all of you.
Gladys, I think you also have, oh, there we go. Thank you. In terms of, again, we're not just looking to address one research question. We are looking to what are all the possible ways where we can use this collective data from the various data points, lifestyle, environment, our genetics, to inform our researchers and allow them to have the opportunity to solve, you know, whatever sort of questions they may have. And next slide, I'll go into a little bit more detail here. With the Research Hub. So one of the things that most recently, you know, we are excited to launch is, again, this idea that this research program is not just trying to collect data or information, but we really want to create a resource that is available for free and has access for everyone. And so there is, you know, the encouragement for citizen scientists, for, you know, high school science teachers, for whomever, to have access to data. And this would be data that is aggregate data, where they can kind of see patterns, trends, and study that for themselves and use it in a variety of different ways, as well as what will be available to researchers, which is the researcher workbench. And this researcher workbench is a place where researchers, just as traditionally as they normally would be approved for whatever research study they're looking to do, but would actually have access to the raw data and would be able to create their own cohorts, so study specific groups of people. Now, this is where that the size, 1 million or more participants, can really make a difference, because we're looking to be sure for that data to be rich and robust, and in order to do that, it has to be representative of the diversity of the United States. And this is that diversity piece where we see, you know, the Latinx's community's opportunity to really step in and have our health voice be heard in the data today, so that in the future we will see outcomes that are for our communities and that are specific to our needs. Next slide. So as I mentioned, some of the opportunities for researchers are, and I just want to highlight in particular that kind of diverse cohort of participants, where a researcher may have an idea to study a certain specific group of people with a certain age group or maybe certain preconditions. And now with a sample size so big, they're going to be able to pull those numbers much more quickly, look at it across, you know, across geography, looking at cross-sectional data. It's a really incredible opportunity to kind of open source this data while still keeping in mind the privacy expectations and care that we have for our individual participants' privacy while we do it. Next slide. So a couple of reasons why, why participate as a Latinx woman, and for those of you who are on the call as well, minorities make up 38% of the U.S. population, but we are our health voice. We are hardly represented in the clinical research trials that are taking place, and therefore, when medical solutions, healthcare options, when different scientific discoveries that lead to medicines and cures and treatments are not exactly created or done with us in mind, and it's time for us to kind of change that, and for us to take a step in the direction of seeing the Latinx voice clear and loud and clear, in our nation, and in the care that our future, our families, our future children will have the option to receive. Next slide. So I'm sure that many of you are aware, but the Hispanic population, as Susanna already alluded to, has indeed suffered quite a bit in this pandemic. There's been a sizable impact on and a disproportionate impact on all minority populations, but especially the Hispanic population, and whether it's access to care, an understanding of the medical options. When we think of diversity, I want to highlight the fact that we're not just looking at ethnicity, or we're not just looking at race, but we're really in this research program looking at age, we're looking at education, we're looking at income, we're looking at the differences between rural versus urban, and in wanting to be inclusive of people who fall in all of those categories. And I'm happy to say that right now the program, more than 80% of the people who participate in our program identify in one of those areas as traditionally underrepresented in biomedical research. Next slide. For our participants, you might be saying, what is the the reason that we would want to encourage our patients to participate, or even your families or loved ones to participate? I think one of the points of this program is really, our participants are partners, and we're looking to empower and give an opportunity for participants to learn about their own health, to be able to advocate for themselves, to be able to advocate for their communities, and the initial step of enrollment involves creating your own participant portal, and in that participant portal is more than just a place where you share your data. It's also the personal and private place where you receive back information about yourself, such as the DNA, should you choose and consent to receive that information back. We also will have additional research opportunities in the future, so it's an opportunity for to meet other people similar to yourself, to understand kind of the dynamics about the community you live in, and really to learn the kind of the ways in which all of these data points that we're taking a look at, right? The way that our lifestyle, the way that our environment, and the way that our genetics plays a role into why we are healthy or why we are sick. Next slide. So to walk us through kind of what we're actually asking participants, this takes about an hour to an hour and a half of time, depending on how comfortable you are with a computer. The first part of the enrollment steps are to consent to participate in the program, and then you actually have to consent to choose, do I want to receive back my DNA information back or not? And we walk through participants with some videos, very clearly kind of the plus and minuses, or the risks that might be associated with receiving back your DNA. Once you've kind of completed the consents, we do have also a consent to share your EHR information. And Suzanne also spoke about this. The electronic health record is an incredibly valuable piece of information and a data point to receive longitudinally, every single time we pull that EHR data, again, de-identified, stripped of any personal identifiers, but pulling that information allows the researchers in the future to see and understand a person's care and treatments over a long period of time and any changes that have occurred, and gives us a much broader picture, right, of the individual, which is what we're aiming towards with precision medicine. If someone has chosen to share their EHR data with the program, we invite them to come in person. Now, there are 3 surveys, the initial surveys that we ask people to kind of share, answer these questions on their own. They can do that in person right now as we're starting to plan for reactivation across all of our sites in Illinois. We do encourage folks to do that online from the privacy of their own home, and comfort of their own home. These surveys cover, basic things about their health and their backgrounds. Then in person, we take your basic physical, so height, blood pressure, weight, measurements like your waist circumference measurement, your hip circumference measurement. We ask for participants to share a blood sample, a urine sample, and then all of those at the end of a visit, a participant will get a $25 Visa gift card. Just, thank you for your time. We appreciate it. And we ask the participants even download the All of Us app if they haven't already, so that they can stay engaged in the program as we continue, because we will continue to share surveys and ask participants to stay engaged with us over the next 10 years or so. If you do have a Fitbit, you are welcome as a participant to share that Fitbit data with the program as well. Next slide. This just gives you an overall look at some of the surveys that we asked individuals to kind of self-report or share on. The first 3 that are listed there are the initial 3 we ask all participants to do. The following 3, numbers 4 through 6, are kind of the next set of surveys that we're really looking to have participants continue to share. Tell us about your family medical history. Tell us about your personal health history. As COVID began, we started doing a COPE survey, or the COVID Participant Experience Survey, where we're trying to gather some information about even how, how has COVID affected not just your physical health, but even your mental health. We are looking to do even more surveys in the future. In the years, we're planning on rolling some of these out. They surround topics such as diet, physical activity, mental health, etc. Next slide. Great. And then just to kind of close, we do have a website that joinallofus.org, but you can also look at any of the sites located in Illinois. So as you saw in a previous slide, we are the Illinois Precision Medical Consortium. I represent the lead site, which is Northwestern Medicine, but we do also have UIC, ULC, Rush, and North Shore, who are all a part. Next slide. And again, feel free to learn more at our website. We will also have our contact information up shortly, but I do want to close this portion of the presentation before the Q&A with a brief video. So give me one moment to share with you all.
Health is wealth. And if you're not healthy, you can't be as productive, so you can't take care of the familia. So what we want to eliminate is fear.
Es un recurso de conocimiento para el futuro.
Es importante que eduquemos a nuestra comunidad a participar, porque si hoy puedo prestarme para esas investigaciones, mañana mis hijos pueden ser beneficiados.
Fui diagnosticada con cáncer de mama hace 3 años. Si yo hubiera tenido más información a mis...
Sorry there. We do have one. Are you seeing the English subtitles? I don't know if you are. I'll keep playing.
Decisiones hubieran sido completamente diferentes. Después de mi segundo diagnóstico, decidí cambiar mi alimentación y mi estilo de vida completamente. Me encantaría participar en programas para animar a las personas a participar en estudios.
Yo estoy muy contenta de que esta va a ser una gran oportunidad para que podamos prevenir enfermedades en el futuro y tratarlas mejor.
We as the Latino community, we as Latino providers, we as community activists, health activists, encourage all of us to stand up and be represented so that we all benefit, not just for ourselves, but for our children and our children's children.
Great. Well, I will hand it back over to Lisa. Thank you, everyone.
Thank you all so much for such an insightful, informative, just a wonderful presentation. Hopefully we have lots of questions because we're going to start with questions. But before we continue, wanted to again recognize our panelists for today and thank Dr. Aquino, Nurse Susana, and Monica for sharing their experiences and expertise working for our diverse communities through the All of Us research program. So I know we had one question about what topics for social determinants of health are being collected or tracked through the participants.
Monica, this is great for you.
That's from,
we did, obviously, our zip codes are pivotal. Your environment where you live is pivotal, you know, and your age and your access to safety, your access to health. So, I mean, I think she went through all of them. So I don't know if you wanted to say a little bit more because you did delve on that.
Yeah, sure. I mean, again, thank you, Susanna. We're really trying to capture all of these, you know, variety of data points. And what we talk about often is these categories of underrepresented biomedical diversity. And some of those categories and the ones that we're primarily focused on in this research program include age, income, education, urban versus rural, obviously ethnicity and race as well. So, you know, things like, you know, language, but, you know, the whole program, I don't think we mentioned it actually, but the whole program, you can participate, you know, from end to end completely in Spanish. We are, you know, hoping to be able to do other languages in the future, but right now someone could actually do all of the surveys in Spanish, as well as when they come into our participant centers, can actually speak to someone on the phone in Spanish, can come in and have someone who's a Spanish speaker walking them through the physical measurements aspect.
Fantastic. Any other questions? I don't see any in the chat box, but if you'd like to unmute yourself, feel free. And so while we have folks contemplating or thinking through some questions, for any of the panelists, what do you think are our current greatest challenges in motivating or encouraging our Latino community to participate in research?
This is Susana. You know, just like anything else, I believe trust factor is a lot to do with it. You know, for so long, communities of color has always, you know, been underrepresented, and especially the Latino community, in a sense, it just hasn't been seen or heard or been included in past decades and past research activities. And I think today you can see the involvement. The video was a perfect, phenomenal example of the efforts and the book and the work that is visibly out there of pivotal leaders that are trying to make sure that we're included at the table. And for me, my favorite is looking at the researchers, Dr. Aquino, Dr. Aponte, individuals that are into research and their passion of wanting to make sure that minority communities are included. So I don't know, Doctora Aquino, if you would like to add to that.
Yeah, I think an important piece is the deliberate outreach to underrepresented groups. And we've seen that through the All of Us program and them partnering with the National Association of Hispanic Nurses, providing funding to chapters across the US to be on the ground, sharing information about the program and really encouraging people to participate. I think that that's really important. You know, Monica mentioned the accessibility of information in Spanish. I mean, that is really key. So I think as researchers, we've come a long way to learn about strategic efforts to make sure that we're deliberately reaching out to those underrepresented groups. And I love the access for researchers across the spectrum to be able to utilize the data in ways that are meaningful for them and the communities that they're in, and to be able to conduct that research and that it's accessible to everyone. So I think we'll see a lot more research studies that are focused on us, and that will really help move forward a lot of the health disparity work that needs to be done.
Very true. And both of you make some really important points, because I think part of it as well, right, is representation, as we're seeing in the chat. Representation of researchers also matters. It makes a huge difference, especially when we're talking about lack of trust or trust that has been broken historically. And having that representation, which has a lag as well, when you look at the total population and the number of Latino, Latina scholars really leading and helping facilitate collaboratively some of this work. There's really a lot of room for improvement there as well, in terms of motivating our and encouraging our youth and supporting and investing in our youth to be able to kind of fuel the pipeline and help be able to bridge those gaps, because there are other issues, as we know as well, language being one of them, right? And the importance of making sure that we have information and clear communication with our communities about why they're being engaged, and where the information is going to be used or how it's going to be used. Could you share a little bit more about that? Like what's going to happen if I was participating, what would happen to my information? Because I think sometimes we feel a little concerned about, like, where's my information going to go and who's going to look at it? Who's going to have access to it?
Yeah, I mean, I can jump in and say that. So all of the information, and again, I mentioned it before, but privacy is a concern for everybody, and the program takes it seriously and takes participants' privacy and information seriously, personal information seriously. And so everything is de-identified. We are all of the samples that are taken, both blood and urine, are sent to our biobank, which is the Mayo Clinic in Minnesota. And all of that they're again restricted personal identifiers, so everything's kind of labeled with a number. All of the data, the information, all the self-reported surveys, all of that data is being collected, and Vanderbilt University is the kind of the mastermind behind our data browser and research hub, and the access to that is managed carefully. So the raw data that researchers will have access to that go through the same kind of IRB regulations and all of the reporting that is still regulated there for the sake of our research being done with human subjects, they will still have to do, and they will go through that same process. But the data is going to be open and available and free in that sense, in that we're really trying to shorten the gap, right? The way that we've done medicine and research previously is with a lot of lag time in between, because it's very difficult. A lot of times it's harder, we'll say, for researchers, right, to choose to do research on Hispanic populations or monolingual populations, and so there's less research being done there. So this is, I think, going back to what are some of the the difficulties here is, when we think about language as a barrier, someone who is monolingual, or even has some, even if they're bilingual, but medical terminology is its own language on its own, can be a real stumbling block for someone who maybe sees a value in a program but is hesitant. And so we're trying to communicate again the importance of this program. And it might not be for, it may be that it's very easy for us to get a lot of youth to participate. Someone who's like 18, 19, 20, they can maybe immediately see, maybe they're English, maybe they're first generation like myself, went to school here, and they have the English language skills to, understand everything clearly. They're probably the person who's helping their parents, like I've gone to the doctor with my parents to make sure they understand. And so we're really asking, we want the mamas and papas to come and participate in the study, because that's the group of people whose information, whose health history, I think will make quite an impact in future research studies.
Now, once somebody participates, thank you, Monica, how many times would they have to return? Is this a one-time thing, or does someone have to come back multiple times to complete a sequence of things?
Yeah. So the initial visit, where we take the blood sample and we take your measurements, right now that's a one-time thing. If for some reason, the researchers pull that participant's, blood so many times that we've used up the sample that we took, they may in the future receive communications about, would you be interested in coming and sharing more? But for the most part, right now, as the program is, and we are constantly evolving and developing. I mean, when we say this is a historic program, not only is this the largest research program that's ever been done, the next closest thing is the UK Biobank with 500,000 people, but it's also, it's historic partly because we've never tried something on such a scale with the diversity component, which naturally should be, but we've never tried it with such a scale. So it is kind of a lot to ask that we hope that participants would stay engaged with us and be flexible with the fact that we may in the future say, oh, would you be willing to come in and share, another blood sample with us? Or they may be invited to participate in other research programs that might involve them coming to, a clinic of some kind to not receive care, but to share samples again. But initially, we're just saying, please do these surveys from home, come in person, share your blood sample, your urine sample, do the physical measurements, and that's the kind of the main part of this research program right now.
That's wonderful. And I think just to kind of break it down a little bit, if someone were to participate, or something that I think it could be reassuring to people in terms of feeling safe, is that in terms of being de-identified, you become a number, you're coded. So no longer will they know that it's, John or Michael or Dr. Rosita Lopez. They'll just know it's number 001, whatever, right?
Right.
So you can be assured that although you're just a number as well, that you're coded as a number, you're not just a number, that your information and each and every one's information is critical. It's a critical piece of each puzzle that helps us be able to provide better medicine. Precision medicine, meaning it's precise to you and people who have similar genetic makeup, which means that the outcome is much more effective. And the sense that I'll give you one quick example, and then I'm going to turn quickly to the chat before we close, because it's never enough time for these conversations. So stay tuned, because we're going to continue the conversation in a different format in the near future. We'll let you know. Once I was having a conversation with a supervisor of mine at a clinic. He said to me, when I realized that precision medicine was so vital, was when I went to my doctor, was diagnosed with diabetes, and got my medication, and on the bottle it says, may not be effective for African Americans. And he said, that's when it really clicked for me. And that's why it's so valuable. We don't know what's going to be most effective for our community, for our people, because of the differences, potential differences and variations in genetic makeup. And that's what it's so valuable that we have that representation. And to know and be assured that we're safe, right? A blood sample, urine sample, those are very benign things that are not going to be harmful to us. We're not being injected or having something done to us necessarily, or providing historical medical information. And I'm going to quickly turn to the chat. There were some great comments here. Someone said, for those of us, there's one quick question, for those of us who may not know Spanish, but want to learn, would you have any recommendations for how we can help bridge any language barriers in terms of specifically being able to, have a Spanish speaking assistant, for instance, available?
Well, El Mexican Consulado, they have some amazing programs on medical Spanish and learning Spanish. And I believe they were free most recently. And I think San Agustin College was also offering the same. So I know that they're very much trying to help providers who are not Spanish speaking to be able to communicate with their clients, with their patients and things like that. So I don't know if Monica or Liz know of any other, but definitely those two.
And sometimes, depending on the size of your organization, through your volunteer services office, you might be able to identify, or if there are community health workers that you might be able to partner with as well. Anybody else want to add anything before we close?
I was just going to add to answer again that question about DNA. If you've participated in the program, even though we're just now returning DNA, we're going to be doing that for all the samples. So if you participated when we first launched, if you participated in 2019 even, don't worry, you just have to go back into your portal and choose, I would like to consent to receive my DNA information back. So that's open to everyone who's already participated, as well as those starting to participate today and onward.
And I do want to say, you have an option to participate in as much as you want, and you can see your data. I can see what I want, and I can get back what I want. And I think I'm very interested in the genetics for me personally. It's something that, I want to make sure that, because they'll offer you, do you want to see it? Do you want to know? And I don't know, maybe I do, maybe I don't. So these are real important things that, as minority women, for me as a mujer Latina, it's to want to feel that I'm contributing and that I'm including to something that hopefully 50 years from now is making a significant difference in our world. We know what the numbers say that we are in this nation. And when medication is given to me, I want to know that this medication is going to help me. And it's going to be given to me because it's something that is going to help heal me, and not that it's never been studied on anyone of our descent. And it was, guys were tested and it worked on them. So let's give it to women and make sure that they're going to be okay.
And yeah, and just to highlight, right, most of the research has traditionally been conducted with white male participants predominantly. So that really does create a barrier there in terms of what we know about the effectiveness of the treatments that we have access to, and who it's effective with, or most effective with, in terms of who's participated in the past. But thank you all again for all of your contributions. We have a log of those of you who had additional comments and questions. And if we didn't get to you, please take our apologies. We will follow up with you offline, and happy again to continue the conversation and share more. There's this lovely article that I will pass on to all of you on the All of Us project called Diversity and Inclusion from All of Us Research Program, a Scoping Review conducted by Brandy Mapes, Dr. Brandy Mapes and colleagues. So you can look for that as a follow-up. I will also be sharing a post-session survey, so please complete it because we'd love to have your feedback. If you want to learn more about our services at Tanoma Consulting, feel free to email us at info@tanomaconsulting.com, or you can email any of us for any additional questions. All of our emails are listed there. Feel free to take a screenshot. The slides will be shared with you as well as the article electronically, so you can look out for that information as well. There you'll also find some additional resources if you're working with communities closely now that we're sort of again hitting another wave of COVID-19 cases. If you know anyone that needs support getting a free test regardless of their citizenship status, you can use that link, chai.gov, covid test, and they can find a site where they can receive those services. Also, there's a food bank locator for anyone that needs support there, or anyone that's having employer safety concerns because maybe they're not supported at their place of employment. If you're looking for more information about research, other sessions and support systems, you can look at Salud America's information. Also, the All of Us research project. Please remember that if you want to participate or encourage others to participate, you can visit www.joinallofus.org, or to learn more about the non-Illinois chapter, you can go to www.nonillinois.org. It has been our esteemed pleasure to have you with us this evening. Before we go, we want to emphasize the importance of practicing the 3 W's. We know how difficult it is for everyone to continue to limit contact. And yes, we know that there is a certain level of COVID-19 fatigue. But as we approach the holidays, it's really now more important than ever, especially now that we're hitting this wave again, for us to adhere to those 3 W's. Wear a mask, encourage others to do the same, because it protects others from you and you from others who may become sick or may be sick and contagious and not know it. Wash your hands frequently to contain the spread, as well as maintain 6 or more feet apart in terms of having safe physical distancing. And this is really truly a way to show love and respect for others, particularly those who live with you, who may be more vulnerable, like our elders, etc. And in closing, please remember to be kind and loving to one another. We never know what someone else is experiencing within their context, lived experience, and reality, especially more so these days. It's important that we lean on love, compassion, and empathy. And together, we truly can make a difference. Thank you. Muchísimas gracias to all of you who have attended this evening. Muchísimas gracias to Susana, Monica, and Dr. Aquino. We hope everyone considers enrolling in the All of Us project and encouraging others to do the same. Thank you again. Peace and love.